What is triage? Bioethics of medical supply rationing. Imagine a busy emergency room during a disaster or a pandemic when resources like ventilators or intensive care beds are running out. How do healthcare workers decide who gets help first? That's where triage comes in. Triage is a process used to sort patients based on how urgent their medical needs are and how likely treatment will help them. It's a way to make tough decisions when supplies are limited and everyone needs care quickly. In situations like natural disasters or widespread disease outbreaks, hospitals can't treat everyone at once. Triage helps prioritize patients who are most likely to survive with immediate treatment. For example, someone with a life-threatening injury who can be saved with quick care might get priority over a patient with less severe injuries. This process ensures that limited resources like ventilators, medications, or hospital beds are used where they can do the most good. From an ethical point of view, triage raises some important questions. It involves making choices that might mean delaying or even denying treatment to some people to save others. The main principles guiding these decisions include justice, beneficence, autonomy, and honesty. Justice means treating everyone fairly without discrimination based on social status or disability. Beneficence is about acting in the best interest of patients by saving the most lives possible. Respect for autonomy involves honoring patients' rights and dignity, even when decisions are difficult. And honesty or veracity means being truthful with patients and families about their care. Most triage systems follow a utilitarian approach, aiming to save the greatest number of lives. Healthcare workers assess each patient and categorize them into groups. Those most likely to survive with treatment are prioritized, while patients unlikely to benefit from treatment might be given lower priority. This approach helps make the best use of scarce supplies but can be controversial because it might overlook social inequalities or marginalized groups who already face health disparities. To address these concerns, triage protocols often include safeguards. These might involve rules to prevent discrimination, ensuring transparency in decision-making, and involving multiple healthcare professionals to review choices. Some protocols also incorporate principles from other moral theories, like egalitarianism, which emphasizes equal respect for all people, or contractualism, which focuses on fairness agreed upon by everyone involved. In practice, trained healthcare workers, called triage officers, evaluate each patient based on established criteria. They look at factors like the severity of illness, likelihood of recovery, and the time needed for treatment. Patients are then grouped into categories such as those who will survive without immediate help, those who need urgent treatment to survive, and those unlikely to survive even with intervention. The goal is to give priority to those who can benefit most from limited resources. During pandemics like COVID-19, triage protocols have been adapted to balance individual needs with public health goals. For example, they emphasize saving as many lives as possible while ensuring fairness and minimizing harm. Healthcare providers also face emotional challenges when making these decisions, so protocols include support systems to help them cope. In summary, triage is a vital process that helps healthcare systems distribute scarce resources ethically and effectively during crises. It relies on core principles like fairness, maximizing benefits, respecting persons, and transparency. These principles guide difficult choices, ensuring that even in tough times, care is provided in a way that is as fair and just as possible.